sigi tha ahumuki phase khambra hadi sida hadi nangi kenodo nangi preparation adai nangi mental nangi wakhan nangi attitude yam thin important oi buko noi kharna exam si asidi chum thari ni kholi ni kaina khan tari khambra nasadi excuse pizza tari khambra I mean the result will not come as it is okay aduga mi khar lai ko hadi adum pekha thabagi je adum phajana thawai yauna chatpa adai demanding oiba matam ko tha humgi matam jida demanding oirakpado hadi revision tawde yaktaba subject ma'am cover tawde yaktaba hard work pi de yaktaba matam hena thada de yaktaba ko aina uba khara de kain toy khamba se phajana la amaga khamba si matam demanding oiba hek matam jida ko hadi there is a point hadi mongonda should I continue? Should I evolve and continue doing this one? Hadi demanding or with demand meet tong lo nagadra or his or her mind will play tricks like as handak mathang thar jar jo handak color jo ete mang ni ko ni handak ti adu tore ada tore excuse pi kanda hadi serious oi ji tokiba yan ta na ko adu to no ko hadi dagi exam experience da ne ko dana hai ji ko khandrim ni na you do not know kai kai toroga khanje ji ni na sana khangjadrim ne ko adna kitang khak demanding or pa face to da you will think something else your mind will play trick right so adu kitang khak khangbi yu ne hadi kitang khak khangbi yu ko khang ba ji nang angonda counseling logera natraga nangi khangna chana ba nangi na senior na tra nangi atopo oja sing the counseling logera do that or even nasana convince togjaraga no si kitang demanding of a face ni ko I know this is a complete change of hanadagi aina tormadudagi complete change of pace complete demand hadi exam gi demand energy level demand focus demand concentration demand hana tormadudagi kitang yamna change la ini ko abrupt change ki type ni ko so adudo understand to utamo khamra adudo understand tor matungda if I like persevere ko like 2 3 4 days ko 4 or even 1 week aina adum ngamnaba adum ai wakhan hong debida hadi ngamnaba adum in gi matang daga mathong gi week tadi easier or kane so it will be like natural or kane khamra so aduna sigi phase hadi 3 4 months prelims walling agi phase khamra si yam demanding oi bine ko from your concentration focus energy tumba chaba adagi nangi thabak ke ka si khamra kaino da pekha ji sida leire pekha naksil e khangmani na ko ana mayam ji si matam ji da either quit to mathong chei thar again or either serious oi gidaba as color da ji wo na tor ga dum mid to ngam da hai tare so adu yamna soigal le ko prelims ki pekha thaba da na traga khan keno da khan ga da khan ga da so aduna adum preserver to aduga hingatnaba quality hingatnaba hono gyan ta na ana sigi potsi si hana swaina chatlamba potsi sidagi demanding oi re ko kaino de exam sida le amina ko so aduna demanding oi posida kamaina meet togani haido adu ina khallo khamra sije it will not work okay sidana sibok de it will be a different level of preparation gyan ta na ko ana sida hana toramba nangi leramba tumba chaba adagi nangi social media paiba adagi nangi langba chatpa adu mayam do kambra sidadi hong tare because the situation sida leba situation ngo si leba situation yo khenam ni na so aduna kadawni kambra routine naiba tamu adi tumba chaba discipline over tamu nangi life pa nangi timetable execute tawada adi social media hando negative over news hando kanada canada di ko ai nang pekhalo kanda prelims ki loibni mituda you can pick it up right adi sima yengba kangbuna sima yengba handa tare yan tare na ko nangi pothaw matam da ngatang pungkhai am pung ama yeng manatana ko minute 30 nga yeng manatana ko so now you have to change according to the demand of the situation for the better okay sidadi I don't care nang pung kya hawali pung kya to me nangi lai pa do pabam thu do pai sidadi sigi demand anobo demand lakni na revision to doini subject no par ka doini adai class su tawini class ju ma'am demand lekni adai nangi revision gi demand basic subjects ki demand current affairs ki demand YouTube tar ka doni khola ka doni adugi amu revision tor ka doni so now you have to change sida labor pot na sida labor apote wa kamra it is all normal to yamna PhD gi wa na te wa kamra adi naturally si noina khan ga do pone in case noina kay u da tar su I am pointing it out yan ta na ka ana 3 4 years prelims 3 4 months prelims what ling hai you have to change according to the demand and you have to change for the better discipline oiba hinga tare focus oiba hinga tare energy conservation haiba tare ko tumba chaba nangi energy pibo khotpa myam ko sije class tore da sije nang taw tare ko manage taw tare ko and if you do that if you do that khambra ana it will automatically take care of the lariki aspects haidi nang basics pagadaba current affairs pagadaba and basics se current affairs ke revision togadaba nang sigis na nangi it will take care of the lariki basic kano do aspect to khambra so siju nang siju yengadam ne ko UPSC ji lai nga to para khana tardi I mean chahi amtang lai pathok babona mi kudima chahi pung train tum eta tungge to eta phudaba yan ta na amai toroga palaga khalan kani have juk select so na lai nga ta na te ko nangi health ko tumba chawa nangi mental attitude ke ka ji khamba si ji yamna phajana manage to ma da ka oy so probably aina sum yeng matam da ko aina manipur gi da khoi manipur da angon advice pi mem da kamai kamai pi khamba manipur da UPSC preparation UPSC ki serious preparation to je khamba leite na hai ba ko ado ya akoina saina yengu tardi yam chumme ba ko haidi mi ma'am di UPSC di noi thanani ko UPSC nimit di every kano center is almost full ko but kyamna serious oirge haido adu ju khandu ya de khamba aduga aina sum yeng matam da aigi chahi 2018 dagi hawpa sida sum yeng matam da ka manipur gi akoi manipuri candidates ma'am na kano to je soi wi kai da soi gi ha matam da kano da pakha maya naksila kanda tha ahum mari ngaisila kanda nangi no demand tor kanda exam jina ko demand tor kanda adu demand piba ngamda adum fizzle out togi badum focus ni khangde energy ni khangde lai pa ni khangde revision to ni khangde adum focus togi aduga adu moise serious oidaba lai pa da radi na tebo si mawang de moi class yaudena kotana adai assignment tawdena kotana homework tawdena kotana doubt hangtana kholktana loi tawnebo ko aduga 3-4 years ki demands kind of 3-4 months wali nga demands hadi basic subjects no impact current affairs no impact adu yam focus ta yamna focus toroga yamna kano da energy management time management discipline demand torpa sida khamra moi ngamde so na manipur dagi kayumba koina prelims khandraba manipur dagi thaba kangbuna prelims khandraba or delhi da leba manipur ma'am na prelims khallaba kaina ha matam ja sigi pochi lay hadi tha ahum mari wali nga ji semdokpa ngamda kyan ta na ko ana siji semdo ko so na hojik se kanadaba distraction ma'am handaro ko social media adagidi kanadaba noida sounding ba negative oiba news ke ka pawa to except for na pa newspaper na traga na kan torido time management phazan toro ko kaino da pung mapan tara jine dum lai par adam ne khama aduga pung mapan tara jina na quality lai pa bangam da tardi hadi UPSC khanbagi damukta pung mapan tara lai pa gani habana te khama UPSC khannabai damukta basic subjects ka current affairs ka parak pa adagidi adugi revision torokpodo adu dum pung mapan tara je dum lojabane ko sigi keno je sigi khenab je yengo khama mi ma pung mapan tara paraga UPSC khanni habna te but UPSC khanga dabagi basic subjects current affairs ma'am fazna parakpodo khama nomada natraga adugi tha ahum mari du da khama pung mapan tara dum everyday consume to ne khama same defect ne ko I mean I will never boast that I will read 9 hours 10 hours ko but the things I have to do in order to get prelims selected nomada tawdo kai no hai matam do di pung mapan tara parakani tumba pung tare khai tumakani ko nungdin da nep am lorokani energy management time management focus yam oriented orakani ko to the point that yum the wari sana thoni ai thabuk ma'am de swain handani kholani ai si tongam ni adu tongam ni na khamra so si hadi si demand ma'am se mit tongam no hono ko adu na ta tar di khamra hadi na sa da ju exam naslak pressure di lakani ko pressure lakko nang demand mit tongam da tar di you will collapse ko number 1 da number 2 da you will take it easy pakha thar mathang thar ne na or number 3 da asibu or do bu ai adu kano MPSC gi tor ne na mind no the trick tor ko ne ba lai thok na ba I see prepare to the MPSC ne trust me MPSC lak tar ju khamra adu de ka ju hengat pangam moy yan ta MPSC maya nak salle en khallo ko asidi kai excuse prepare kani khamra du na as MPSC bu corruption tor ga mayam khana do ai khan mangam rai dum ai ju tapda thai ni na khallaga khamra lai paning oi lai pa lai thorokani am torokani ko so now you have to guard these things okay so this is very important apart from all the studies and all the revisions you are going to do okay so adugi expect ni dan haining ba ko ana mentally kitang strong oi ba daka oi gyan tai na ko adu yamna su kano oi ba nate discipline la you preserve to work matam du da ko take it easy haidi nang adu matam du da ko but don't yield to the easy things like mathang tharge natraga ai khan mangamar damni natraga si exam ji ai MPSC ki thai maram pisan jab to excuse pisan jab to over khamba ware dana ko patho you rest for the day okay you see movies you rest for the day but next day try to give another attempt. Okay, alu bade pi desu alai alai bade sum horo khambra sum horo khambra nasada convincing oi mem haijau khambra hadi nangna jun gi current affairs se pahodre hai tarju adam jun gi current affairs se question tara hang kani hai question question ahum hang abauda it's okay, I'll handle. I atoba pa hi mem da I will handle it and khambra hadi kitang khak positive oiba optimistic oiba tamo khambra aduga ai aswaina ju khanjaba tamo ko hadi noi different budi tonga le ko satra noi yawi mem ji ko hai anova first thagda yawi second tharba third tharba yawi ko ana nasada convince tau jo khambra hadi optimistic positive oiba ai handi par khama tani all I have to do is do revision adedi akoi da hoina natra ai handaki preparation ji di kanani khanba si mem lai rawni so na handaki di result oriented oini khotni nasada boost tau jaba optimistic ai adu si hajin du na te khambra asengbu pot ne khambra. For example, you can always boost yourself ko hadi by just having the notion that aina class high khot liba experience share to ma'am jina khambra nahamuki prepare to digi handakti kano gi dalwang gi swaina experience share to ini aduga adisyo swain to semdo ini swain to like pai ni high bi dadang nonda nangi negative oiba natraga nangi excuse pi da ma ma adum lokthop ya bane gyan tai na ko si to even aina kamai to jar ke ha matam duda 2014 15 17 da thakpa matam du ko warkpa matam da adai 2016 na completely lepure like shooting thing dire ko ai Bombay da lai ngai da ko aku magi adu da to da ko 2017 obviously it was hard, obviously there are so many doubts ko ai like shooting thing this ai negative oina khalam tari ko ai khalang ni khambra as ai like shooting thing udre last attempt ni ko adai di mi ma'am di lai panaramani coaching chatana khotana tongnaramani ai kamai to du no khotoino ai adumai negative khanba ma natraga i I can see the positive. Like, okay, Hana Khangrab exam ni, I know what to do. I just have to pick it up one step at a time, slowly, slowly, slowly. I just have to be consistent. I just have to be, disciplined. Preserve toroga agi timetable lama semaga follow to wadavdani. And in order to do that, I have to just maintain my time, manage my time. I tumba chaba, I diet manage to tare na danaba, tumba chaba phasna na phan tare, aduga agi timetable execute to tare. And if I take these steps slowly go, then give 1 month, I'll be kind of back on the track. So it happens ko. I try negative lom da ju chat kya positive lom da optimistic or lom da ju chat kya ko. And I think I chose the optimistic one ko. So I am easily adum prelims clear to prelims to kan adum mains adum clear to and I last interview adum changa adum piram ko. I did my best ko. So I have nothing to do kind of beyond that ko. And that is it. I live adum low ko. But I preparation phase to the I try to like always project something in an optimistic or in a positive way. Say for example, no ma'am imarta hujik na sanu aita ba na ko pa yang ni khambra. So do na yam disheartened to mo as I tha kamai tha du ko to no na record kre mathong ki chai phajan tha ki khot na khambra. Gyan tai sin optimistic way da chat pa ko ko. Adu tarju se one positive way da kamai la ka ni khambra. Okay, na ba si I control la hujik na ai phalani ko. Aduga ai tumba chaba diet even exercise na dana ba ai to tare hadi yen yam chaba thum yam chaba handa tare junk food yam chaba handa tare ko achamba aphaba nuts kumba walnut kumba oats kumba cha tare ko so adudang chage khanba adudang sindoke khanba duda you have achieved like 50% of the health battle di aduda loyam ne adudang ngamabne ko and give it like one more week ko and you will be better gyan tare na ko hadi soina wakandasu yam thina lei hai tare ko so na sigi matam ja guard your mind and your heart very well. Okay, no excuse changan gano, no negative changan gano hek changra wa khambra adi it will make you like feel easy go that as mathang thar ge da sig exam jiding ngamori dam ni da natra MPSC den nai ge da na ko and trust me hadi almaina like thok khrani ko mathang handa exam tha da ba yawnara ni tha ta ju serious win tha da ba oina ni ko and trust me MPSC da tha ge na khallaga amaina khalla lagi ma'am do kamra when MPSC comes ko you will give one reason or the another okay no that it's not about the exam UPSC MPSC one at it's about yourself hadi nang the situation namna nang the for a better chance to gi opportunity MP matamda nang na do how hard it may be khambra nang na adu the grabs to ga change to the tari khambra you will never change school gi exam oigra MPSC oigra I can UPSC oigra change to ni ko so number 1 adu makalo so huji matam je khambra hadi guard yourself very well hai tare ko so na avoid distractions focus on the time management and focus on the health focus on the sleep and even if you can hadi nang exercise am kana to hai nate ko just walk your evening or your morning nang lai pa da matam da or your afternoon whenever ko. It will make you sleep well. It will chaba thakpa nungai nasa phalakani ko. Aduga even confidence booster kani ko. Mayam exercise toroga nungai na haise kemte na teo khambra. There is a whole science behind it. How it makes you feel. Gyan tayo na ko. Exercise to buda ako na kano live ni ko. Okay, ko maming khar live ni ko. Na kana Robin Sharma gumba ta tardi adum khang ni ko. Chemical khar live ko. Endorphins sabra. It will make you happy, and if when you are happy nangi happy mutalaita you always positive and nang tawge khanba ngamme ko, and even when you become healthy khambra nang tawge khanba ngamme ko. So na kay gumba nang preparation je one khanta when you are healthy, when you are happy, when your mindset is positive khambra, it will automatically do it kyan tayo ko aduna ne hadi. If you think that aina agi UPSC journey da, if you think that I have not sacrificed anything, then you are very wrong. Hadi yamna sab thakwa tor tumba sab mathong khangdraga ina clear talk ne hatadi, you are very wrong. Kaino da I think I have given up pork, beef, etc. just because kemte natte ko lai religion yamte natte ko kano pork aina thadok khibje pork 2012 13 dorangani ko. Just kaino ha matam jida I realized something that aina pork chab khiding ne khambra amon haksang yam nungai te ba khambra adna adu nimitu ma pura mangal le ba khambra. Aina I masidi I so sorry I like aina ai career natraga like ki matang nan track nom serious oiba ma tawri ai so sorry I chagi de adu chagi de I sacrifice pork I pame kana who won't like pork, right? How in it tasty or in it in camera. So I want to take chawa I want no item I want to like power ka level. So number one I have to let it go. So my to ebo ko adagidi ai nungdang da yam hin chak chasulomo adagidi exercise to ni kay na matam da I came to know that health yadavs na kadoy camera. However nangi panam na nangi motivation fanam high way tarju kambra. If your body cannot perform nangi spirit jam high way tarju as nairage khotlage taw tarba. If your body cannot perform, then everything is lost. So do na ay number two the ko I have realized the importance of health. So do gine ay na I don't I healthy unhealthy pot ke ka ay taw de ba kama ay you or churu adu or the junk food or adu or ka I should taw de ba kama just because it will make me healthy and it will make me prepare well gyan tayo na. So may na sigumba je sigumba je taw ko. Ako da mobile ka na silent so may na khambra so na yam crucial but ni matam ni khambra you have to guard your mind and your motivation very well. Okay, heart hay tare ka very well. So anyway, let's continue the class, right? Yo akhona nan noin to ko health che khoina global perspective tagi akhona catch story ko global gi movement kai lena traga gi global gi kari collaboration lai kari conference lai kari declaration lai gena ko global gi matang da khoina charang to gre aduda miss to wa mani khak orang ne khoina miss to ko adudi da pa kha do ina question ina hangaga adu do ina explain to ge ko aduga next akhona india gi matang da khoina to re ko adu akhona ngasi to jin hai si schemes ma'am do ne ko important schemes ma'am to ko but adu to dringa adu akhona ngarang nahan gi the first global ga India gi to class da akhona ihogada kitang wa leba khambra adu do hani ise ko adu le kind schemes ka programs to je ko adum te isin diwa akhona namu haina gi do hadi health ki definition je kamaina pi kholi adi adu do aduga health che kai important oina ha matam jida da number 1 da essay da means da hangba topic ne gyan da na ko aduga health na akhona education gi type ta akhona economy da su da mi ma'am duna human resource na yamna impact tor koni na khambra health is very important aduga number 2 da kai khambra the impacts of health se nangonda engonda member feel to nga ta ne khambra hadi according to our akhoi class matung ina hadi pesa pai daba kai thabak to daba yumda kamai to daba lam gi rural urban matung ina khoi da health to nga ta ne ko ai hujing no khoida kano ma hangan gani ba khambra hadi horen kano ma chat ta haila kane ba ko ko how adu kano to thokro chan cancel to thokro da ai horen no di han yani ba khambra like India gi health system natrai health policies ma'am jida nangna kari soye khanba natraga nangna kari phai khanba ma'am khambra ada akhoi gi igdoriba essay ogera mains ogera or si matungina neba akhoi da policies and programs and schemes semaize gyan ta na ka se akhoi health soiba ji kaino khambra out of pocket expenditure hadi ꯑꯩꯈꯣꯏꯅ ꯏꯟꯗꯤꯌꯥꯗ ꯁꯨꯝ ꯌꯦꯡꯉꯨ ꯃꯇꯝꯗ ꯈꯪꯕ꯭ꯔꯥ ꯍꯥꯏꯗꯤ most of the population ꯁꯦ ꯀꯃꯥꯏꯅ ꯇꯧꯒꯦ ꯍꯥꯏ ꯃꯇꯝꯁꯤꯗ ꯍꯦꯜꯊꯇ ꯈꯪꯕ꯭ꯔꯥ ꯃꯣꯏꯅ ꯇꯥꯟꯖꯔꯛꯄ ꯄꯩꯁꯥ ꯃꯌꯥꯝꯁꯦ ꯑꯦꯛꯁꯄꯦꯟꯗꯤꯆꯔꯁꯦ ꯀꯥꯏ ꯆꯠꯀꯦ ꯍꯥꯏ ꯃꯇꯝꯁꯤꯗ ꯀꯩꯅꯣꯗ ꯆꯠꯇꯕ ꯏꯖꯨꯀꯦꯁꯟꯒꯨꯝꯕ ꯅꯠꯇ꯭ꯔꯒ ꯁ꯭ꯀꯤꯜꯒꯨꯝꯕ ꯅꯠꯇ꯭ꯔꯒ ꯑꯦꯁꯦꯠ ꯂꯩꯕꯒꯨꯝꯕꯗ ꯆꯠꯇꯕ ꯍꯦꯜꯊꯀꯤ ꯑꯥꯎꯠ ꯑꯣꯐ ꯄꯣꯀꯦꯠ ꯑꯦꯛꯁꯄꯦꯟꯗꯤꯆꯔꯁꯤꯗ ꯆꯠ ꯂꯩꯔꯝꯃꯦꯕꯀꯣ ꯑꯦꯟ ꯗꯤꯁ ꯏꯁ ꯋꯥꯟ ꯑꯣꯐ ꯗ ꯕꯤꯒꯦꯁ ꯔꯤꯖꯟ ꯐꯣꯔ ꯄꯣꯕꯔꯇꯤꯗꯩ ꯍꯥꯏꯒꯠꯄ ꯉꯝꯗꯕ ꯅꯠꯇ꯭ꯔꯒ ꯄꯣꯕꯔꯇꯤ ꯑꯣꯏꯔꯝꯗꯕ ꯃꯤ ꯄꯣꯕꯔꯇꯤꯗ ꯑꯣꯏꯔꯛꯄ ꯁꯨꯃꯥꯏꯅ ꯑꯣꯏꯌꯦꯕ ꯈꯪꯕ꯭ꯔꯥ ꯁꯣ ꯑꯗꯨꯅ ꯑꯣꯀꯦ ꯐꯥꯏꯟ ꯑꯗꯨꯅ ꯁꯨꯃꯥꯏꯅ ꯇꯧꯔꯅꯦꯕꯀꯣ ꯑꯩꯈꯣꯏ ꯏꯟꯗꯤꯌꯥꯒꯤ ꯍꯦꯜꯊꯀꯤ ꯁꯤꯁꯇꯦꯝꯁꯤꯗ ꯑꯥꯎꯠ ꯑꯣꯐ ꯄꯣꯀꯦꯠ ꯑꯦꯛꯁꯄꯦꯟꯗꯤꯆꯔ ꯃꯌꯥꯝꯁꯦ ꯌꯥꯝ ꯆꯠꯂꯦ ꯁ꯭ꯄꯦꯁꯤꯌꯦꯜꯂꯤ ꯐꯣꯔ ꯂꯥꯏꯔꯕ ꯃꯌꯥꯝꯒꯤꯗꯤ ꯁꯤꯁꯤꯅ ꯄꯣꯕꯔꯇꯤ ꯑꯣꯏꯕꯒꯤ ꯃꯔꯝ ꯑꯃ ꯑꯣꯏꯍꯜꯂꯦ ꯑꯗꯨꯅ ꯑꯩꯈꯣꯏ ꯄ꯭ꯔꯣꯒ꯭ꯔꯥꯝ ꯑꯃ ꯁꯦꯝꯃꯁꯤ ꯍꯥꯏꯔꯒ ꯑꯩꯈꯣꯏꯅ ꯀꯩ ꯁꯦꯝꯃꯛꯏ ꯈꯪꯕ꯭ꯔꯥ ꯄ꯭ꯔꯥꯏꯝ ꯃꯤꯅꯤꯁꯇꯔ ꯍꯧꯖꯤꯛꯀꯤ ꯉꯁꯥꯏꯒꯤ JAYꯗꯣ ꯖꯟ ꯑꯔꯣꯒ꯭ꯌ ꯌꯣꯖꯅꯥ ꯏꯟꯁꯨꯔꯦꯟꯁꯀꯤꯁꯨ ꯁꯦꯝꯃꯛꯑꯦꯕꯀꯣ ꯏꯟꯁꯨꯔꯦꯟꯁꯅ ꯀꯩ ꯇꯧꯔꯤꯅꯣ ꯍꯥꯏ ꯃꯇꯝꯁꯤꯗ ꯈꯪꯕ꯭ꯔꯥ ꯍꯦꯜꯊꯁꯤ ꯑꯩꯈꯣꯏꯅ ꯑꯥꯎꯠ ꯑꯣꯐ ꯄꯣꯀꯦꯠꯇꯒꯤ ꯆꯠꯍꯜꯂꯔꯣꯏꯕ ꯈꯪꯕ꯭ꯔꯥ ꯁꯣ ꯒꯣꯔꯃꯦꯟꯅ ꯁ꯭ꯀꯤꯝ ꯁꯦꯜꯂꯒ ꯑꯩꯈꯣꯏꯅ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯁꯦ ꯂꯣꯏ ꯇꯧꯍꯜꯂꯅꯤ ꯑꯗꯨꯒ ꯑꯩꯈꯣꯏꯅ ꯄꯩꯁꯥꯁꯤꯗꯤ ꯏꯟꯁꯨꯔꯦꯟꯁꯀꯤ ꯊ꯭ꯔꯨꯗꯩ ꯄꯤꯔꯅꯦꯕ ꯒ꯭ꯌꯥꯟ ꯇꯥꯔꯦꯅꯀꯣ ꯁꯣ ꯑꯗꯨꯃꯥꯏꯅ ꯑꯗꯨꯅ ꯁꯤꯗ ꯑꯩꯈꯣꯏꯅ ꯏꯟꯗꯤꯌꯥꯒꯤ ꯍꯦꯜꯊ ꯁꯤꯁꯇꯦꯝꯁꯤꯗ ꯀꯔꯤ ꯁꯣꯏꯒꯦ ꯍꯥꯏꯅ ꯌꯦꯡꯉꯛꯄ ꯃꯇꯝꯁꯤꯗ ꯈꯪꯕ꯭ꯔꯥ ꯅꯪꯒꯤ ꯅꯁꯥꯗ ꯄꯥꯟꯕ ꯅꯪꯅ ꯇꯧꯍꯟꯅꯤꯡꯕ ꯅꯠꯇ꯭ꯔꯒ ꯅꯪꯒꯤ ꯑꯦꯛꯁꯄꯤꯔꯤꯌꯦꯟꯁꯁꯦ ꯊꯦꯡꯅꯈꯤ ꯃꯌꯥꯝꯗꯣ ꯍꯥꯏꯔꯛꯑꯣꯕ ꯈꯪꯕ꯭ꯔꯥ then it is a valid reason adum valid adum oil lenganeba you don't need to read articles or you don't need to read editorials or you don't need to read current affairs to understand what is wrong with the health system of India gyan tayena ko ayambadi noina amamam hainarappada ko it will fill up the pages aduga yes kitang kak technical loiba akoina thengnadaba akoi issue na thengnadaba akoi manipur na thengnadaba asomna kandana henna thengnaba mayam khadi chitharamganeba ko adudi amu akoina class toroga menkhat kadoineba ko so mine toroganeba akoina si ma saduji khamba but anyway idringai dana akoi ngasai health care definition do asi health care definition pi ji kaina ha matamjida dana sa habdo health is a very important topic of essay manipur gi MPSC da su aduga kanogi UPSC da su ana health ki definition khangwa ko aduga manipuri MPSC da kanoda akoina kan essay gi prepare tor matamda health ki prepare tor matamda definition ke ka khang ka toine ba issues ke ka khang ka toine ba aduga even manipur gi schemes ke ka khang ka toine ba se MPSC noi thaloren khalo ko men se ka aduga health ki matang essay mi ro health ki definition irani akoina tori ma'am se irani aduga schemes na kaino khambra manipur gi sarkar gi health ki schemes le ma'am do kai kaino handak lebido smart card kam sembado aduga keba CM gi keba haksel gi tengbang habra kaino ma leibu insurance ke ka adu do mu jiki PMJY ji mu integrate tong no tawri ne ko so mine tawraga gyan ta na ko so mine tawra si ma'am si I doine ko aduga si ma'am ji ile kanda mark phangaga khalaka doine ko adu ana blind da sutok to bidaba gyan ta na adum keno tawri ko ko da health ki definition do kala I be engsa cheese yamangre okay okay sidi nga sigi mala da her ke ko cheese okay okay so 1 2 2 3 4 singa sigi class ki ko dagiti nan class ki da chile taka sinute ko ai chi mo wale kadai chu oh sile yeah I think she on okay sije yeah am tation view ba sigi health ki definition ja it is not a new definition right alma ata declaration to budo haidi akoina nan discuss to grena alma ata declaration 1978 ta piba health ki definition ne ko and it is accepted everywhere ko kaina matam jada it covers all the aspects of health right mental health ko cover to ko ana si definition dem ta view ko si definition mem ko akoina nan dai health ki concept health ki structure sagal ko so now we need to get down to the some facts hai tare ka and health ki definition ka si ji ka almata definition ni ka a complete state of complete physical mental and social well-being a state of complete physical mental and social well-being well-being ka, and not merely the absence of, see, and not and not merely the absence of disease or infirmity. Instead of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, comma, is a fundamental human right, and is a fundamental human right, and that the health to, and that the attainment of, and that the attainment of the highest possible level of, and that the attainment of the highest possible level of health is a most important worldwide social good, whose realization requires the action of many other social and economic sectors, in addition to the health sectors. So in some health ki definition and concept yang matamjida, I think this one is the most elaborate, and this one is the most comprehensive definition regarding to health. Gyan tayo na ko. Adugo no na definition na itar de khamra. Just write this one ko. A state of complete physical, mental, and social well-being ko, which is a fundamental right ko, and whose realization, which is a fundamental right and a social good ko, whose realization impacts other social and economic sectors. CEVI ko. Ay dana underline to remember. A state of complete physical, mental, and social well-being, and not merely the absence of disease. When health, when absence of nadri, when healthy or any kind of adu definition, not take when chumna khanari definition. Complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, which is a fundamental right and a social good, and whose realization will make all the other sectors realization possible. Gyan tayo na ko. Aina sum health definition ma'am di yung matamda. This is the most comprehensive and the most extensive definition of health ko. So I really want ay si dum pining ko. So si dum iyo ko. Ano nga sidagi mina health si hangpo matamda. You have to write these things, right? So first dana ko na si thaw do sim layer ko. Chemba. Yeah, so do next thing on next we'll do another concept. I see the CD noina irakadonico. See this one, you have to write it, type it on the chat, okay? Noi canona ka, noi traum do yours in the car. Noina health system in matang that noi the experience noi layer me ka. That noina tengnagiba Delhi do egra Manipur do egra noina kanjaba noina tengnagiba noina pa giba noi personal experience tengnagiba khamra. Health systems in the khamra. Kari lacking or in a kale. Noina tengnagiba hire you adagidi noina pakiba kotiba kanba wakanda kanba kot hire jai. So amam hire on this. Muna color hire. Ani hire jai you can say any number but you write on the chat please. Okay, no da koina nai to tar ju khambra koina si gi matang je koina keno da koina ꯀꯩꯅꯣꯗ ꯊꯦꯡꯅ ꯑꯩꯈꯣꯏꯅ ꯁꯤ ꯏꯔꯝꯗ ꯇꯥꯔꯗꯤ ꯈꯪꯕ꯭ꯔꯥ ꯑꯗꯨꯗꯤ ꯑꯩꯈꯣꯏꯅ incomplete ꯑꯣꯏꯅꯦꯕꯀꯣ like a preventive approach okay Oliviaꯒꯤ ꯏꯔꯛꯑꯦꯀꯣ okay doctor population ratio ꯏꯔꯛꯑꯦ ꯑꯗꯩꯗꯤ Oliviaꯅ ꯏꯔꯛꯏꯁꯤ preventive health ꯋꯥꯠꯂꯦ ꯈꯜꯂꯦ ꯑꯗꯒꯤꯗꯤ awareness ꯋꯥꯠꯂꯦ ꯈꯜꯂꯦ ꯑꯗꯒꯤꯗꯤ ethics ꯏꯔꯛꯑꯦ infra ꯏꯔꯛꯑꯦ ꯑꯇꯩꯗꯤ okay health workers Devina ꯏꯔꯛꯎꯗꯅ ꯈꯔ Devina ꯌꯥꯎꯕ꯭ꯔꯥ ꯑꯩ ꯉꯁꯤ ꯈꯪꯗ꯭ꯔꯦ okay funding okay expensive secondary tertiary infrastructure ꯌꯥꯎꯈ꯭ꯔꯦ okay ꯑꯊꯣꯏꯕꯤꯅ infrastructure ꯑꯇꯣꯞꯄꯗꯤ yeah disparities ꯑꯇꯩꯗꯤ lack of research yeah aware okay awareness ꯌꯥꯎꯔꯦꯀꯣ ꯑꯊꯣꯏꯕꯤꯅ ꯏꯔꯛꯑꯦ ꯑꯃꯨꯛꯀ insuranceꯒꯤ ꯏꯔꯛꯑꯦ lack of research ꯏꯔꯛꯑꯦ trust between doctors and patients ꯑꯇꯩꯗꯤ ꯈꯜꯂꯨꯅꯦ ꯅꯣꯏꯗ ꯊꯦꯡꯅꯈꯤꯕ ꯅꯠꯇ꯭ꯔꯒ ꯁꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯅꯤꯄꯨꯔꯗ ꯂꯩꯔꯤꯕ ꯏꯃꯥ ꯃꯥꯔꯀꯦꯠꯇ ꯐꯝꯕ ꯏꯃꯥ ꯃꯌꯥꯝꯅ ꯊꯦꯡꯅꯕ ꯍꯦꯜꯊꯀꯤ ꯀꯩꯅꯣꯁꯦ ꯐꯦꯛꯇꯔꯁꯦꯀꯣ okay state list so poor okay poor state ꯑꯇꯩꯗꯤ funding ꯌꯥꯔꯦꯅ I got it inadequate knowledge of patients okay lack of world class facilities hence need to travel to Mumbai yeah ꯑꯇꯩꯗꯤ nutritional factors ꯁꯤꯃ ꯆꯨꯝꯃꯦ preventive promotive ꯂꯥꯛꯇꯣꯏꯅꯤꯀꯣ nutritional factors ꯀꯣ so sumaina khambra hadi nangna slow monitoring device and lack of nurse and patients in case of emergency okay GDP expense low okay yaure hana na yaugre ka okay so sumaina khambra hadi akoina just akoina health ki problem na hire kan health akoi India ki health system jida kari issue legi hire kan da noina just khabar de paraga magazine de paraga mi amna article am ibidu paraga nangna haibe yare first adu pa jinai da nasana khangba nasana experience thengnaba nasana pagi me or nasagi internal lojaba India ki health system matang da kari no hire matam da kenoda nasana kari hana khalakya habdo adu ma'am do hana iyo ko lack of professionalism in doctors and in government hospital and PHCs ko adu sigi pot ma'am je ko si pot ma'am je kana amtana la le na kak pa roiba ko no in chumme ba khambra say if someone is saying that doctor ga population ga ratio lay hai ta di human resource ta what le hai do ne ba ko adagi di sida preventive healthcare lay hai ta di India gi health system je khambra curative lom da chatle promotive preventive rehabilitative palliative what le hai do ne chumme ba gyan ta na ko infrastructure hai ta di ko what level ko infrastructure ji human resource ki or say kanogi machines ke ka gi ko noini sida palamba mo wale ko drugs quality drugs ko or generic drugs ki ko quality level drugs control ke ka do ko and aduga magi health equipments ke ka ji ko simo wale hadi costly oi bido ko simo wale ko so aduga sig infrastructure hai tar di nangi keno da akoina akogi health ki akoina hospital ke ka sabada khotpada kan infrastructure leitaba or human keno da or human resource leitaba je chingne ko and sida health workers ko training phajan tawdaba accreditation phajan pidaba adedi keno regulation phajan tawdaba and sida funding hai je chumme ko hadi GDP yam thina low oi ko comparing to like most of the developing countries India ki GDP ja do adugi matik low rangani ko and disparities ko hadi disparities mayam lay ko health system assess tawno hona ko lair ba ina khun mayam gi marak ta ko lair ina khun mayam na insurance lorangani lair mayam na even ina khun mayam bo insurance lawte but they can manage it but ꯂꯥꯏꯔꯕ ꯃꯌꯥꯝꯗꯤ ꯀꯩꯗꯧꯋꯦ they cannot access the health system ko so ꯑꯗꯨꯗꯣ ko sometimes we see doctor impatient and lack of qualities and sida nangi sigi sometimes nang ngasai sida hainakhiba professionalism watle doctor ga nurse kada doctor ma'am impatient oi lack of qualities and skill oi khotle haije khamba kaida lakan ha matam sida professionalism ethics and integrity nam yawe ko si aina haijen manate khamba national health policy ne khamba 2017 digi ne khamba first india health system the semdo ka devja kai hana oyami khamba professionalism integrity and ethics na yawe khamba gyan ta na ko ana noina health system jida noina thengnaba experience ma'am khamba adu ma'am du nangna munna khandare iba matam da mayam langani ko sida state list yawba poor kano tawra drugs patent ya sima dana drugs sima tang hai ko lack of research pacha thada da baini aduga initiative laitaba gyan ta na ko aduga even nang IPR ke ka do pan be ay ba khambra india da IPR phajana leite ko ana india da research tawgi drugs ki research tawgi kano je scope se private na yam thada de ko adu government na tawbra haidi kasu yam tawbo oi de ko so adugumba issues ma'am lay ko adegi di sida expensive oiba sima wa like kana sima chumme ko adegi ke wachi sida wrong diagnosis treatment sine akoina professionalism adegi akoina ethics integrity na lai ko adumaina sida akoina sida noina bak akoina sida yawe ko adu noina ngasai sida kitang khak panba watlamba khadi leire ko haidi equity access laitaba ko haidi state amaga gyan ta na ko haidi or say sections of people amaga ko and inequalities ko so siguma ma'am je akoina noina bak kano da chingye ko especially for Manipur, the highest post of Manipur matang the health ki matang the yeah see governance change because regulation to ma'am na go health ki system da government ki health apparatus system da regulation to ma'am na government or na ko government ki inefficiency corruption administration ki corruption governance soy khotpa ma'am lai khamba yam nokning ba Manipur health ki da ko Manipur government ki health ki system da ko to wuje keba reappointment ki wari je ko reappointment of keba mogi director Jenims ki director Rims ki director ki reappointment ki wari janti nokning mane ko masi lawyer ni mai matam chahi ju lawyer ni ko retired to ni ko but reappoint hata to kane manung da kai lege du ai hire roi gyan ta ne ko but you can reappoint to pade doctor ma'am protest tong na khotna dana adu reappoint to ba roi mai matam lawyer khotle adu du to na ko yam chawba administrative inefficient oiba corruption gi mami tawa mayam yauri ba khamba so na si mayam na khoina health ta noina ba kano oiba ko aina khanbada huji rims ta paiba director do reappoint to director rangani jenims ki ju reappoint to director mo oiram mani adu huji pudi oidram ni ko adu kanna mayam na kano tong nagi ko ngangna gi ko aduga noin sai palambada kitang watpam na ko hadi noina sidi noina khalam kano khandharam oiba ko kaino da sigumba pot mayam ji noina experience thengnadam ni na ko like akoina alternative health alternative system of health kanogi alternative system of medicine natraga akoina alternative system of healthcare ko hadi manipur da si akoi kya thengna deba ko ayush natraga ayurveda gumba je khamba hadi si moina alternative ne ko as compared to allopathic kyan ta si jo akoina hapsin be ay khamba akoina health system gi akoina kari issues legi ha matam da kari no akoina ayushki health system je manipur da lawdri je kai no or say da UP natra Bihar da they are ready to adopt this one or Himachal Pradesh they are ready to adopt this one awareness what pa misconception mayam je koina lokthokpa ngamdaba quality papers quality research thoktaba to the point that kadawe khambra American mayam na homeopathic ti hadi homeopathic ki treatment ji da henna hakchang da soli khotli kaina ga haibdo khambra and they are saying this without any research but America gi pharmaceutical company na hire amne na mayam noi thajei ba ko so du so sigum mayam je akoina tawtar di akoina tawe ba khambra like gi da ayush ki da sum ayurveda na traga yoga na traga homeopathic ka unani ga siddha esi ke ba siddhi ba siddha ba sigidi khangdri bu ka but ayurveda or yoga or homeopathic akoina adum experience tawda adum yaw pot ngata ne ba ko hadi it is not all about medicines ko sigi medicines lai hanate but the processes ko hadi nang na di ke chagni khotani adu du tongni ada tongni ko or even yoga da or ju ko hadi nang body stress na traga to we ma'am ji ko kana message thai se s ki matang se hayang siddha hai okay Cost of studying MBBS is very costly and hence many aspirants do not get. Yeah. It is all there. It is all there. So admaina. So nang na essay ama iyo haiba gi matamda natraga nang na discussion ama to haiba matamda natraga nang na kenoda mains answer writing ama iyo haiba matamda. You always don't need to remember like aina like the kai paki magazine da kai paki article da kai paki haiba gi khan adum khan be daka oi de khan be matam su lai roi aduga thok su tholo eba khamra kenoda nang na paki ma'am do integrate tawdoineba nangi system na tra nangi structure ama semaduda ana nangi experience nangi integrate tawbo pot ma'am do dagi tholakadoineba si jengone noina yam line tholai jeng si je answer du makne india health system da kari kari watli gen aduga noina hek toina thengnadaba adagi experience hek lairudaba pot ma'am duna swaina dana like dagi swaina pira is drugs kumba ayus kumba ko so na side ta khambra akoina ngasagi health system tor maduda ko noina harpa point nga tu oidoni ko but in some other way like in say noina doctor ge patient ga ratio what li hai tardi human resource what li hin haidoni ko adi example the doctor ga patient ga ratio yanta or aduga se nang na patient ki bed ki ratio what li hai tardi infrastructure what li haidoni so noina hai ma'am achum banga tane ko ada big picture on thora kanda answer writing amain e wani da yanta na ko so anyway health care system tarko matam da ka saina akoina health care system ke kan oi tawkhre ko kai lei adu do lei my structure ke kan oi tawkhre ko hujikna magi challenges and magi award pa ko challenges and kahani award pa ke hai inista yeah in ka health system ka challenges and amta hairudna challenges and
limitations.
keba
Limitations.
keba tadre iko thwe type toro okay yeah shortcomings good shortcomings har jo hai adagidi amazu e kanana limitations har jo hai good yeah see what ka idea chu ma'am jai far haide ai mind thok pudini has and the mind lak to jai ka sida number 1 gi da ka sum yeng je ka challenges ka sida 5 A's and ka ningjing manu ai na ka sidi healthcare experts amana accept to ne ka india gi healthcare system da 5 A's se challenge ni na traga limitations ni tra shortcome ne ka number 1 da ka awareness am what level ka or awareness ki lack of it people are not aware. They are only aware when they are sick or when they need any medical attention, right? They are not aware of the magi health system ki matang di aware de kari facilities phangmi matang di aware de they are not aware of promotive health, preventive health aware de ka. So adugini akoina promotive ka preventive health ki aware de bisina ne hujik non communicable diseases ka like lifestyle diseases ma'am jina ka hetna health burden mo ri India gi health ki expenditure da yan ta na ko like cancer diabetic heart ki cardio adai tobacco sinaba yan ta na ko or aduga say akoina fluorosis kumba akoina pollution dagi health or ko ma'am se kam aware am to oi de yan ta na so adu hadi diet ki matang de aware oi de ka so adu so na yone thum ga chini ga hena chabsi na diabetic ka bp ga thole haibje aware oi tardi people will cut it down junk food ni khangde amani khangde trans fat ki matang da aware oi de gyan ta na ka ana si matang de aware oi de or aduga si matang de natabida health kari facilities like kari schemes like ge amte aware oi de gyan ta na karamba de chat kani kamai tor yeng ni khot kani je aware oi de ka ana India health system da one of the biggest challenge or shortcomings is awareness or lack of awareness ka adu mo yeba ka number 2 the access can be for so many reasons ka aware oi dabadagi ka or nangi tangu budagi ka like lilabati kaina mumbai lay hospital yam di khallo na dum de even tata hospital jo yam tangi o khamra hai tata hospital da public anam lay aduga kenogi ageba general habam lay aduga private anam lay bo khamra so private chi yam tangi bo khamra se aina khangbada akogi general da ju category mem khaido ebo ko haidi kenoda antadoya or bpl card paiba antadoya paiba card kaina ko or adur sum simple micham general ko like akhoi ma hoine yeng oi ko so sida akhoi na kemo ka matam da ko hidak se pulup lai matam da 1200 tai hidak se haidi kemo ma ka matam da and hidak se yam yame bo ko macha yam yame bo ko ada bpl na tra antadoya paiba di lupa yang khai da ꯐꯪ ꯆꯞ ꯃꯥꯟꯅꯕ ꯍꯤꯗꯥꯛꯁꯦ ꯀꯣ ꯑꯗꯨꯒ ꯆꯞ ꯃꯥꯟꯅꯕ ꯍꯤꯗꯥꯛꯁꯦ ꯈꯪꯕ꯭ꯔꯥ ꯄ꯭ꯔꯥꯏꯚꯦꯠꯇ ꯀꯥꯞꯄꯗꯅ something like 18,000 ला or something like 12,000 ला something like ꯑꯃꯥꯏꯅ ꯑꯣꯏꯌꯦꯕꯀꯣ ꯌꯦꯡꯉꯣ ꯈꯦꯠꯅꯕꯁꯦ ꯌꯦꯡꯉꯣ so ꯑꯗꯨꯅ ꯑꯩꯈꯣꯏꯅ ꯍꯦꯜꯊ ꯐꯦꯁꯤꯂꯤꯇꯤꯁꯇ ꯑꯩꯈꯣꯏꯅ ꯑꯦꯁꯦꯁ ꯇꯧꯕ ꯉꯝꯗꯕꯁꯤ ꯀꯩꯅꯣ ꯍꯥꯏꯕ ꯃꯇꯝꯗ ꯀ꯭ꯋꯥꯂꯤꯇꯤ ꯍꯦꯜꯊ ꯀꯦꯌꯔꯗ ꯑꯦꯁꯦꯁ ꯇꯧꯕ ꯉꯝꯗꯕꯁꯤ ꯗꯦꯔ आर so many reasons ꯑꯦꯋꯦꯌꯔ ꯑꯣꯏꯗꯕ ꯄꯩꯁꯥ ꯇꯥꯡꯕ ꯑꯗꯩ ꯃꯐꯝꯗꯨꯗ ꯔꯤꯖꯟꯗꯨꯗ ꯂꯩꯇꯕ ꯒ꯭ꯌꯥꯟ ꯇꯥꯏꯅꯀꯣ ꯗꯦꯠ ꯕꯣꯝꯕꯦ ꯉꯝꯅꯗꯕꯒꯤ ꯅꯠꯇ꯭ꯔꯒ ꯇꯧꯅꯗꯕꯒꯤ so many cancer patients are doing treatment here ko in Manipur ko admaina ko so excess se akoina leitaba ko or lack of it ko aduga number 3 da absence of human power or resource ko human resource in healthcare ko absence of sidi adum da haida jare ko number 4 da affordability afford tongam ko hidak te horoga my process ma'am do gyan ta na ko atu so na tata hospital di my phawam lei mogi maharashtra kangbu ojata di ko maharashtra kangbu ojata di mogi tongan scheme am lei ko si scheme ji da hek changraba adu tari nangi tata hospital gi treatment ma'am no free to wi mong ne atopa mine law ya de ko maharashtra gi dang ogeda but bpl card ke ka ogeda gyan ta na ko aduga atopa state te na kain to khambra there are so many trusts there are so many ngos and civil society organizations ko aduna moina adum pbu ko se aikoina leringa duda kwathen de ni pim cham lerame ko masi mayum dam kan moji laire bu ko aduga magi everything blood tagi horaga everything magi hidaki cost lainabi cost se kai tore khambra mana si apply tore ko ngo ma'am ji apply tore kanda magi bank account am pire ko bank account du hapsalak pane aduga mai tata card am leibu ko tata gi magi patient di card am adu hapsalak doine pasha lupa lising tara hapsalak yawi lupa yang khai hapsalak yawi no mu ko lupa chonga hapsalak yawi ko amai toroga completely amai toro yengri ne yan dai na ko amai but adu khangdaba natraga adugi criteria ma'am du fulfill tongomdaba ma'am di effort tongomde ko aduga number 5 ta accountability ya kanoma si matamda kanom thok matamda accountable kanana accountable oirino habje gyan ta na government na oira natraga doctor na oira nurse na oira patient party na oira accountability gi channel ji phan laitaba adna kanoma thorok matamda responsibility ji nan thorok responsibility lorok taba responsibility ji phan khaidok taba so na health care da yam kano ohele impact ohele ko dana si hai ma'am ji noina bak magi khoina sang na magi example ga loina na case studies ga loina noina bak explanation leyebo ko but adudi ko na pajaro ko da adudi hujik takpa ngamore ko hujik te khoina prelims ki kitang oriented oramina but sigi ma'ams ne heading ne gyan ta na ko adu adagi di si manga se lore ko 5a se ko adu atop de ngone ka atopada sijna kanana pirami khambra experts ka sijna world ki experts ka haiding asagi who gumana ka india health system matang da yeng matam da kari kari soye khotya habdu ka adudo world ki experts natraga who gumba organizations na ka number 1 da ka need to make sidedum iro ka chamane dan explain to ma'am do ka need to make people and processes in the healthcare more accountable ka adagidi transparency tata years ka law institutions and less than adequate human resources in all level especially the primary health centers ka or primary health care ka the lack of infrastructure asai no in high human do ni ko dana sum iramon lack of infrastructure ka shortage of efficient and trained manpowers ka hadi doctor patient ratio ji huji kya lai khambra 0.7 doctors india lai ji ka for 1000 people 0.7 oitardi 10 puriro sida 7 doctors for every 10,000 people mi 10,000 da doctor tare ne lai ji ka aduga who na kya subscribe to wi 2.5 doctors for every 1,000 people hadi 25 doctors for every 10,000 people 10 na puriraga ka atari yone kya no deficient region like 3 times right 3 more than 3 times deficient hoye ka doctor patient ratio ji ka atu yan ta na so anyway sigum bane kha easy ka aduga masi class hobo hode enter sidi nan aina pihowdawne adugi dana sum noaitra pihowdaws but it's okay hadi si ma'am si dana hoin thara so sumaina ka hadi etc sumaina nangi issues and programs ma'am da soina health ki matang da lay ma'am da soina oyeba ka anyway masi class horse ka hayeng class lay ko handakti aina khanbada full week tawdo man handakti I really want to complete this classes and everything one okay koi policy horje ko aduga policy hore aduga ngasai the definition pi bada dana ama pi hodi ko primary health centers si kai no na ko si definition dana se mana de ko ngasai gi alma mater kenogi declaration du da yaw definition du ni ko magi definition kai no and magi importance kai no have je ko so adu da horen tharke horen message tharkani ko adu adu ngasi gi class ki oina khoina tawdu si yeah I think this one number 1 the National Health Policy 2017 National Health Policy 2017 huji India da healthcare natraga India gi schemes programs sem semi khambra sigi National Health Policies na guide toroga natraga si na achoba structure amoraga semine Ayushman Bharat sempa sidagi ni ka adagi de koina doctor recruit tong honar ju sidai ni adagi de koina infrastructure pin honar ju sidai ni ka si na no dictate to we gyan ta na ko National Health Policy aduga si je yam sangbra haidi sang debo ka aduga pekhada hangba yabra haidi exam relevant we thi yaw le me sida my page si 31 pages muktang oyebo ka but every pages is like to the point oyebo ka but adu dana page ne makti panbadi ngamoy ka aduga dana exam gi important oy khanba na traga na National Health Policy 2017 jida nangna khangada khada adu di da ha ke ka adu kari cover tawi kari kano cover taw de ka ayo India National Health Policy 2017 in ahan manate ka we have National Health Policy 1983 National Health Policy on 2002 gyan ta na ka si da khoina National Health Policy 1983 aduga 2002 je si torme ka si je khoina 5-year plans ki da adum akoina full kano da phumma torme ka but kadore khambra when we reach the like 21st century ki second decade york matam da say 2014-15 harone or 2020-21 harone ka 2017 the same na 2014-15 harone 16 harone ka things have changed ka had 1983 na 2002 da leramba pot to dagi khambra things have changed kai change tor ka matam jida si matam jida di infant mortality rate natraga maternal mortality rate se wang bani na ka health policy am as see the focus on the hone but this has come down significantly to the point that akoina huna hello have natraga akoini sustainable development goal da laigadam ni have ma'am do adu yorok to rebo so adna si ma'am si handare ko aduga atopa hengelakpa yam yaw ko like non communicable diseases ma'am cancer diabetic cardio ke kaji hengel ko so aduna kaidore khambra akoi keno je akoigi kenoje akoina health policies akoigi national health policies khambra it changes ko hadi hana gi 2002 1983 ga manare ko it changes according to the change and the demand of the time so sin number 1 khangadaw ko aduga number 2 khangadaw na kaino khambra we have come to know that health is just curative na te ko and all aspects of health cover ko curative preventive promotive rehabilitative and palliative si je koina cover to hore ko aduga next ta koina health ko health akoina kaino soi ja matam jida out of pocket expenditure sina India gi mi ma'am jida khambra poverty si to hole ko an akoina health insurance ke kada focus to hore gyan tar na ko so na akoi changing time se si ne ko adu ge ngo sida next ko magi key policies ma'am je ko si de happy ibiramu ko horen dana pekhagi do kari oibino have do adum ha ke ko si ꯑꯗꯨ ꯉꯁꯥꯏꯒꯤ ꯑꯩꯈꯣꯏꯅ ꯁꯤꯗ ꯑꯗꯨꯝ ꯏꯕ ꯌꯥꯏꯀꯣ ꯅꯦꯁꯅꯦꯜ ꯍꯦꯜꯊ ꯄꯣꯂꯤꯁꯤ 2017 ꯑꯗꯣ ꯂꯣꯏꯅꯃꯛꯇꯤ ꯏꯕꯩꯗꯤ ꯀꯥꯟꯅꯗꯦ ꯖꯁ ꯃꯥꯏ ꯈꯪꯅꯕꯗꯣ ꯁꯣ ꯗꯦꯠ ꯅꯪꯅ ꯍꯌꯦꯡꯋꯥꯏ ꯍꯦꯜꯊꯀꯤ ꯃꯇꯥꯡꯗ ꯑꯦꯁꯦ ꯏꯔꯛꯄ ꯃꯇꯝꯗ ꯑꯣꯀꯦ ꯏꯟꯗꯤꯌꯥꯒꯤ ꯅꯦꯁꯅꯦꯜ ꯍꯦꯜꯊ ꯄꯣꯂꯤꯁꯤ ꯑꯃ ꯂꯩ ꯑꯗꯣ ꯃꯥꯅ ꯇꯧꯅꯤꯡꯉꯤꯁꯤ ꯀꯩꯅꯣ ꯍꯥꯏꯕꯗꯣ ꯑꯗꯨꯗꯣ ꯀꯩꯅꯣ ꯂꯥꯛꯅꯕꯅꯤꯀꯣ role of government in shaping health systems ꯀꯣ ꯀꯩꯀꯩꯅꯣ ꯏꯟꯚꯦꯁꯃꯦꯟꯕꯨ ꯑꯣꯏꯔꯁꯨ ꯔꯤꯒꯨꯂꯦꯁꯟꯕꯨ ꯑꯣꯏꯔꯁꯨ ꯑꯗꯒꯤꯗꯤ ꯇꯦꯛꯅꯣꯂꯣꯖꯤꯕꯨ ꯑꯣꯏꯔꯁꯨ ꯍ꯭ꯌꯨꯃꯦꯟ ꯔꯤꯁꯣꯔꯁꯄꯨ ꯑꯣꯏꯔꯁꯨ ꯀꯣ ꯑꯗꯒꯤꯗꯤ ꯑꯣꯔꯒꯅꯥꯏꯖꯦꯁꯟꯁ ꯀꯩꯀꯥ ꯑꯣꯏꯔꯁꯨ ꯗ꯭ꯔꯛꯁ ꯀꯩ ꯑꯣꯏꯔꯁꯨ ꯁꯤ ꯃꯌꯥꯝꯁꯦ ꯀꯣ ꯑꯦꯛꯁꯤꯇ꯭ꯔꯥꯁꯦ ꯈꯪꯕ꯭ꯔꯥ ꯒꯣꯔꯃꯦꯟꯠꯀꯤ ꯔꯣꯜꯁꯦ ꯔꯤꯌꯦꯂꯥꯏꯁ ꯇꯧꯍꯧꯔꯛꯑꯦꯕꯀꯣ ꯏꯟꯗꯤꯌꯥꯒꯤ ꯍꯦꯜꯊ ꯁꯤꯁꯇꯦꯝꯗꯀꯣ ꯅꯝꯕꯔ 1 ꯑꯗꯨꯒ ꯁꯤꯒꯤ ꯍꯦꯜꯊ ꯄꯣꯂꯤꯁꯤꯁꯤꯒꯤ ꯀꯤ ꯄꯣꯂꯤꯁꯤ ꯄ꯭ꯔꯤꯟꯁꯤꯄꯜꯁꯦ ꯀꯩ ꯀꯩꯅꯣ ꯑꯣꯏꯒꯦ ꯍꯥꯏꯕꯗꯣ ꯀꯤ ꯄꯣꯂꯤꯁꯤꯁ ꯄ꯭ꯔꯤꯟꯁꯤꯄꯜꯁꯦ ꯀꯩ ꯄ꯭ꯔꯤꯟꯁꯤꯄꯜꯁꯀꯤ ꯀꯩꯅꯣꯁꯦ ꯈꯪꯉꯣꯕꯀꯣ ꯄ꯭ꯔꯤꯟꯁꯤꯄꯜꯁꯀꯤ ꯏꯝꯄꯣꯔꯇꯦꯟꯁꯦ ꯈꯪꯉꯣꯕ ꯑꯩꯈꯣꯏꯅ ꯏꯟꯁꯇꯤꯇ꯭ꯌꯨꯁꯟ ꯑꯃ ꯂꯩ ꯃꯇꯝꯗ ꯅꯠꯇ꯭ꯔꯒ ꯑꯩꯈꯣꯏꯅ ꯄꯣꯂꯤꯁꯤ ꯑꯃ ꯂꯩ ꯃꯇꯝꯗ ꯃꯥꯒꯤ ꯄ꯭ꯔꯤꯟꯁꯤꯄꯜ ꯌꯥꯎꯔꯝꯒꯅꯦꯕꯀꯣ ꯄ꯭ꯔꯤꯟꯁꯤꯄꯜꯁꯤꯗꯤ ꯌꯥꯝꯅ ꯚꯥꯁ ꯑꯣꯏꯕ ꯌꯥꯝꯅ ꯚꯦꯛ ꯑꯣꯏꯕ ꯀꯩꯅꯣꯅꯦꯕꯀꯣ ꯗꯤꯀ꯭ꯂꯦꯔꯦꯁꯟ ꯑꯃꯅꯦꯕꯀꯣ ꯕꯠ ꯅꯪꯅ ꯇꯧꯔꯤꯕ ꯑꯣꯕꯖꯦꯛꯇꯤቭ ꯅꯠꯇ꯭ꯔꯒ ꯅꯪꯅ ꯀꯩꯅꯣ ꯑꯦꯆꯤꯞ ꯇꯧꯅꯤꯡꯉꯤꯕ ꯄꯣꯠ ꯃꯌꯥꯝꯗꯣ ꯈꯪꯕ꯭ꯔꯥ ꯄꯣꯂꯤꯁꯤꯁꯀꯤ ꯀꯩꯅꯣ ꯃꯌꯥꯝꯗꯣ ꯄꯣꯂꯤꯁꯤꯁ ꯑꯣꯏꯒꯦꯔꯥ ꯌꯣꯖꯅꯥ ꯑꯣꯏꯒꯦꯔꯥ ꯁ꯭ꯀꯤꯝꯁ ꯑꯣꯏꯒꯦꯔꯥ ꯀꯣ ꯁꯤ ꯄ꯭ꯔꯤꯟꯁꯤꯄꯜꯁꯤꯗ ꯂꯣꯏꯅꯃꯛ ꯄꯣꯏꯟ ꯇꯧꯒꯗꯕꯅꯦꯕ ꯍꯥꯏꯗꯤ ꯁꯤ ꯄ꯭ꯔꯤꯟꯁꯤꯄꯜꯁꯤꯗꯒꯤ ꯊꯣꯛꯂꯛꯄꯅꯦ ꯍꯥꯏꯇꯥꯔꯦ ꯁꯤ ꯃꯌꯥꯝꯁꯦꯀꯣ ꯑꯗꯨꯒ ꯄ꯭ꯔꯤꯟꯁꯤꯄꯜ ꯑꯁꯦ ꯀꯩꯅꯣ ꯑꯦꯁ ꯌꯥꯝꯅ ꯀꯩꯅꯣ ꯑꯣꯏꯖꯕ ꯚꯥꯁ ꯑꯣꯏꯖꯕ ꯑꯗꯨꯒ ꯌꯥꯝꯅ ꯀꯩꯅꯣ ꯑꯣꯏꯕ ꯀ꯭ꯋꯥꯂꯤꯇꯦꯇꯤꯞ ꯑꯣꯏꯕ ꯍꯥꯏꯇꯥꯔꯦ ꯀ꯭ꯋꯥꯟꯇꯤꯇꯦꯇꯤꯞ ꯅꯠꯇꯕ ꯀ꯭ꯋꯥꯂꯤꯇꯦꯇꯤꯞ ꯑꯣꯏꯕ ꯄꯣꯠꯅꯦꯕꯀꯣ ꯁꯣꯅ ꯏꯟꯗꯤꯌꯥ ꯅꯦꯁꯅꯦꯜ ꯍꯦꯜꯊ ꯄꯣꯂꯤꯁꯤ 2017ꯁꯤꯗ ꯀꯔꯤ ꯀꯤ ꯄ꯭ꯔꯤꯟꯁꯤꯄꯜꯁ ꯄꯤꯒꯦꯗꯣꯀꯣ ꯌꯦꯡꯉꯣ ꯁꯤꯗ ꯄ꯭ꯔꯣꯐꯦꯁꯅꯦꯂꯤꯖꯝ integrity and ethics ꯁꯤꯁꯦ ꯉꯁꯥꯏ ꯅꯣꯏꯅ ꯍꯥꯏꯅꯗ꯭ꯔꯥ ꯗꯣꯛꯇꯔꯅ ꯑꯗꯨ ꯇꯧꯋꯤ ꯑꯗꯥ ꯇꯧꯋꯤ ꯑꯗꯩꯗꯤ ꯅꯔꯁ ꯃꯌꯥꯝ ꯀꯣꯑꯣꯄꯔꯦꯇꯤꯞ ꯑꯣꯏꯗꯦ ꯈꯣꯠꯇꯦ ꯑꯗꯨꯗꯥꯅ ꯈꯪꯕ꯭ꯔꯥ ꯑꯗꯨ ꯀꯩꯒꯨꯝꯕ ꯑꯩꯈꯣꯏꯅ ꯑꯗꯨ ꯁꯨꯝ ꯍꯦꯟꯖꯤꯜꯂꯛꯑꯕ ꯄꯣꯂꯤꯁꯤ ꯅꯠꯇ꯭ꯔꯒ ꯑꯩꯈꯣꯏꯅ ꯔꯨꯜ ꯑꯃ ꯁꯦꯝꯃꯛꯀꯅꯦꯕ ꯍꯥꯏꯗꯤ ꯒꯣꯔꯃꯦꯟꯠꯀꯤꯁꯦ ꯀꯩꯅꯣꯃ ꯍꯥꯏꯗꯤ ꯂꯣ ꯑꯃ ꯁꯦꯝꯃꯛꯀꯅꯦꯕꯀꯣ ꯂꯣꯗꯨ ꯀꯩꯗ ꯕꯦꯁ ꯇꯧꯔꯛꯀꯅꯤ ꯍꯥꯏꯕ ꯃꯇꯝꯗ ꯁꯤꯗꯩ ꯂꯧꯊꯣꯔꯛꯀꯅꯦꯕ ꯒ꯭ꯌꯥꯟ ꯇꯥꯔꯦꯅꯀꯣ ꯅꯝꯕꯔ 2ꯗ ꯏꯀ꯭ꯋꯤꯇꯤ ꯀꯣ ꯅꯝꯕꯔ 3ꯗ ꯑꯦꯐꯣꯔꯗꯦꯕꯤꯂꯤꯇꯤ ꯁꯤ ꯃꯌꯥꯝꯁꯦ ꯅꯪꯒꯤ ꯀꯩꯅꯣꯗ ꯑꯦꯐꯣꯔꯗꯦꯕꯤꯂꯤꯇꯤ ꯑꯗꯣ ꯄꯩꯈꯥꯒꯤꯗꯤ ꯍꯥꯏꯔꯛꯀꯦꯀꯣ ꯄꯩꯈꯥꯒꯤ ꯄ꯭ꯔꯤꯂꯤꯝꯁꯀꯤ ꯑꯣꯏꯅ ꯀꯃꯥꯏꯅ ꯍꯪꯉꯛꯄ ꯌꯥꯒꯦꯗꯀꯣ ꯑꯦꯐꯣꯔꯗꯦꯕꯤꯂꯤꯇꯤ ꯀꯣ ꯁꯤ ꯃꯌꯥꯝꯁꯦ ꯅꯪꯅ ꯂꯣꯏꯅꯃꯛ ꯇꯁ ꯇꯧꯒꯗꯕꯅꯦꯕ ꯅꯪꯅ ꯍꯦꯜꯊꯀꯤ ꯀꯩꯅꯣꯝ ꯏꯕ ꯃꯇꯝꯗ ꯑꯦꯁꯦ ꯑꯃ ꯅꯠꯇ꯭ꯔꯒ ꯑꯟꯁꯔ ꯔꯥꯏꯇꯤꯡ ꯏꯕ ꯃꯇꯝꯗꯀꯣ ꯅꯝꯕꯔ 4ꯗ ꯌꯨꯅꯤꯚꯔꯁꯦꯂꯤꯇꯤ ꯅꯝꯕꯔ 5ꯇ patient centric or quality centric treatment quality centric number 6ꯇ accountability ꯌꯥꯝ ꯏꯝꯄꯣꯔꯇꯦꯟ ꯑꯣꯏꯀꯣ ꯑꯩꯅ ꯈꯟꯕꯗ accountability ꯂꯩꯇꯗꯤ ꯀꯩꯗꯧꯔꯦ ꯗꯣꯛꯇꯔꯅ ꯑꯗꯨꯝ ꯃꯤ ꯑꯗꯨꯝ ꯃꯥꯅ ꯅꯦꯒ꯭ꯂꯤꯖꯦꯟꯁ ꯆꯥꯕꯗꯒꯤ ꯑꯗꯨꯝ ꯃꯤ ꯑꯃ ꯑꯗꯨꯝ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯂꯥꯟꯅ ꯇꯧꯕꯗꯒꯤ ꯑꯗꯨꯝ ꯁꯤꯕ ꯃꯌꯥꯝ ꯌꯥꯎꯋꯦꯕꯀꯣ ꯑꯗꯣ ꯀꯩꯒꯤꯅꯣ ꯃꯥꯅ ꯑꯗꯨꯃꯥꯏꯅ ꯇꯧꯔꯤꯗꯣ ꯆꯦꯛꯁꯤꯟꯗ꯭ꯔꯤꯗꯣ ꯀꯩꯒꯤꯅꯣ ꯍꯥꯏꯕ ꯃꯇꯝꯁꯤꯗ ꯃꯥꯒꯤ ꯑꯦꯛꯁꯟꯁ ꯃꯌꯥꯝꯗꯣ ꯑꯦꯀꯥꯎꯟꯇꯦꯕꯜ ꯑꯣꯏꯔꯣꯏꯅ ꯆꯦꯛꯁꯤꯟꯗ꯭ꯔꯤꯅꯦꯕ ꯑꯗꯣ ꯑꯩꯈꯣꯏꯅ ꯑꯦꯀꯥꯎꯟꯇꯦꯕꯤꯂꯤꯇꯤꯁꯦ ꯐꯖꯅ ꯁꯦꯠ ꯇꯧ ꯇꯥꯔꯗꯤ ꯗꯣꯛꯇꯔ ꯑꯣꯔ ꯅꯔꯁꯦꯁ ꯀꯣ ꯑꯦꯅꯤ ꯋꯥꯟ they will be like taking care of these things because ꯀꯩꯅꯣꯝ ꯁꯣꯏꯕ ꯃꯇꯝꯗ ꯃꯣꯏꯗꯤ ꯑꯦꯀꯥꯎꯟꯇꯦꯕꯜ ꯑꯣꯏꯗꯣꯏꯅꯤꯅ they will be like ꯆꯦꯛꯁꯤꯟꯗꯣꯏꯅꯦꯕ ꯑꯗꯨꯅ ꯑꯦꯀꯥꯎꯟꯇꯦꯕꯤꯂꯤꯇꯤꯁꯦ ꯋꯥꯠꯂꯦꯅ ꯑꯗꯨꯃꯥꯏꯅ ꯀꯩꯅꯣ ꯇꯧꯋꯦꯀꯣ ꯂꯧꯅꯩꯀꯣ ꯁꯣ ꯑꯗꯨꯅ ꯁꯤꯒꯤ ꯅꯦꯁꯅꯦꯜ ꯍꯦꯜꯊ ꯄꯣꯂꯤꯁꯤꯁꯤꯗ ꯑꯦꯀꯥꯎꯟꯇꯦꯕꯤꯂꯤꯇꯤꯒꯤ ꯀꯩꯅꯣꯁꯦ ꯌꯥꯝ ꯆꯥꯎꯅ ꯄꯤꯌꯦꯕꯀꯣ ꯑꯗꯩꯗꯤ ꯅꯦꯛꯁꯇ inclusive partnership it can be with world bodies, it can be with private, it can be with civil societies ko partnership ko or it can be with the people aduga next pluralism sida not just one kanogi not just one allopathic natraga chemical gi natraga koina huji khangnariba hidak si nataba but pluralism haitardi there are different lines of kanogi alternate systems of medicines lay have the ko sida ayush and harmoko. So Ayush was given much emphasis in National Health Policy 2017. Okay. 9, the decentralization. Center dagi state dagi amuk local bodies ma'am dako. Aduga number 10, the dynamism and adaptability harmal adaptability. Yamane nangna akoina health ki definition kana ACM easy na khallobo ko. Sigi ma'am jin nangna pillar o hellobo ko. Si ma'am jin pillar o hellobo ko. Aduga nang sigi equity matangda paragraph machang ibiramba paragraph machang duda nangna schemes kumba hapsen biramba or ꯑꯇꯣꯞꯄ ꯀꯟꯇ꯭ꯔꯤꯁꯀꯤ ꯄ꯭ꯔꯦꯛꯇꯤꯁ ꯑꯃ ꯍꯥꯞꯆꯤꯟꯕꯤꯔꯝꯕ ꯑꯣꯔ ꯀꯦꯁ ꯁ꯭ꯇꯗꯤꯁ ꯑꯃ ꯍꯥꯞꯆꯤꯟꯕꯤꯔꯝꯕ ꯅꯦꯛꯁꯇ ꯑꯦꯐꯣꯔꯗꯦꯕꯤꯂꯤꯇꯤ ꯃꯇꯥꯡꯗ ꯑꯃꯨꯛ ꯏꯕꯤꯕ ꯁꯨꯃꯥꯏꯅ ꯑꯦꯐꯣꯔꯗꯦꯕꯜ ꯑꯣꯏꯍꯟꯒꯗꯕꯅꯤ ꯈꯣꯠꯍꯟꯒꯗꯕꯅꯤꯅ ꯑꯃ ꯍꯥꯞꯆꯨ ꯁꯤꯒꯤ ꯄꯣꯏꯟ 10ꯁꯤꯗꯪ ꯏꯕ ꯅꯪ ꯑꯦꯁꯦ ꯍꯦꯜꯊꯀꯤ ꯑꯦꯁꯦ ꯐꯖꯕ ꯑꯃ ꯊꯣꯛꯑꯦꯕꯀꯣ ꯁꯣ ꯁꯤꯁꯤꯅꯦ ꯑꯩꯈꯣꯏꯅ ꯑꯦꯁꯦ ꯔꯥꯏꯇꯤꯡ ꯑꯅ ꯍꯥꯏꯔꯤꯁꯦꯀꯣ ꯑꯦꯁꯦ ꯔꯥꯏꯇꯤꯡ ꯍꯥꯏꯔꯒ ꯑꯩꯈꯣꯏꯅ ꯁ꯭ꯇ꯭ꯔꯛꯆꯔ ꯌꯥꯎꯗꯕꯤꯗ ꯄꯨꯡꯏꯗ ꯏꯕ ꯌꯥꯄꯣꯠꯇꯦ ꯒ꯭ꯌꯥꯟ ꯇꯥꯔꯦꯅꯀꯣ ꯄꯨꯡꯏꯗ ꯏꯕ ꯃꯤ ꯃꯌꯥꯝꯅ ꯀꯩꯗꯧꯅꯤ ꯈꯟꯕ꯭ꯔꯥ ꯏꯗꯤ ꯈꯟꯖꯕ ꯄꯦꯖ ꯑꯃꯗ ꯑꯦꯐꯣꯔꯗꯦꯕꯤꯂꯤꯇꯤ ꯄꯦꯖ 5 ꯏ ꯂꯩꯔꯝꯃꯦ ꯑꯗꯨꯒ ꯄꯦꯖ ꯔꯤꯃꯦꯅꯤꯡ ꯄꯦꯖ 2ꯗꯨꯗꯅ ꯁꯤ ꯃꯌꯥꯝꯁꯦ ꯏ ꯂꯩꯔꯝꯃꯦꯕꯀꯣ ꯁꯤ ꯑꯦꯁꯦꯁꯦ ꯐꯖꯗ꯭ꯔꯕ ꯑꯦꯁꯦꯅꯤ ꯒ꯭ꯌꯥꯟ ꯇꯥꯔꯦꯅꯀꯣ ꯁꯣꯝꯅ ꯗꯥꯅ ꯈꯤꯇꯪ ꯏꯂꯥꯕꯣꯔꯦꯠ ꯑꯣꯏꯅ ꯇꯥꯛꯏꯁꯦ ꯍꯦꯜꯊꯁꯦ MPSCꯒꯤ ꯑꯦꯁꯦꯗ ꯍꯪꯉꯤ ꯑꯗꯨꯒ UPSC ꯑꯦꯁꯦꯗꯁꯨ ꯑꯣꯜꯋꯦꯁ ꯍꯪꯉꯦꯕꯀꯣ ꯂꯥꯏꯛ ꯏꯖꯨꯀꯦꯁꯟꯒꯤ ꯇꯥꯏꯞꯇꯀꯣ ꯀꯔꯤ ꯀꯔꯤ ꯏꯗꯣꯏꯅꯣ ꯀꯔꯤ ꯀꯔꯤ ꯑꯥꯏꯗꯤꯌꯥ ꯂꯩ ꯈꯣꯠꯄꯅꯣ ꯍꯥꯏꯕꯗꯣ ꯑꯗꯨꯗꯣ ꯑꯣꯏꯗꯣꯏꯅꯦꯀꯣ ꯁꯤꯃ ꯂꯩꯔꯦꯅꯀꯣ ꯑꯗꯒꯤꯗꯤ ꯅꯦꯛꯁꯇ ꯂꯣꯏꯔꯦꯀꯣ ꯄ꯭ꯔꯤꯟꯁꯤꯄꯜꯁꯇꯒꯤ ꯃꯊꯪꯗ ꯅꯦꯁꯅꯦꯜ ꯍꯦꯜꯊ ꯄꯣꯂꯤꯁꯤꯒꯤ ꯑꯣꯕꯖꯦꯛꯇꯤꯞꯁ ꯃꯌꯥꯝꯁꯦ ꯀꯩꯅꯣꯗꯣꯀꯣ ꯁꯤꯗꯗꯤ ꯅꯪ ꯄ꯭ꯔꯤꯂꯤꯝꯁꯀꯤ ꯀꯣꯏꯁꯟ ꯌꯥꯎꯔꯝꯒꯅꯦꯕꯀꯣ ꯑꯗꯨꯗꯣ ꯁꯦ ꯐꯣꯔ ꯑꯦꯛꯖꯥꯝꯄꯜ ꯀꯣꯏꯁꯟ ꯑꯃ ꯏꯔꯨꯅꯦ ꯀꯣꯏꯁꯟ ꯑꯃ ꯄ꯭ꯔꯤꯂꯤꯝꯁꯀꯤ ꯀꯣꯏꯁꯟ ꯑꯃ ꯀꯣ which of the following is one of the objectives of the National Health Policy 2017 ka A, B, C, D ka setting up of foreign healthcare institutions ka setting up of foreign healthcare institutions ka giving focus to non-generic medicines ka they see the universal health coverage ka the public health to be the sole prerogative of government to be the sole prerogative of public health system. Okay, answer in ro kay answer lagi na. Please write the answers. Atay di. Okay. B. Life expectancy increase. Okay. Yeah, the answer is B. Okay, like akoina for the first time aduga B universal health coverage se kanana karama committee ne pigi habdo sigi board committee je adum yawle dana health ki no pa mathamde ka because it's important is because this committee has for the first time suggested probably universal health coverage. Okay, so na sigi akoina national health policy 2017 jida magi objectives ma'am do sai akoina principles igre na ka objectives ma'am je kai lege ha matam jida sigi number 1 da progressively to achieve universal health coverage. Kaya da mi fazana si fazana pada kangbu de as universal health coverage amta tadri khotri ana lale kaina kholam moido ne ba khambra so to maina ka adai di next ka number 2 da assuring have the akoina structure togre akoina discussion to ba togre ka ana sigi national health policy je khambra it should be meaningful to you by now iriba point khudimak noida meaningful oiramadam ne khambra so that is the whole purpose. Okay, aduna tadi si akoina phabai type lak do ne hojiti noi khangbai type lak do ne ko and you will be able to appreciate all the points ka 3 4 all the points gyan ta na ka kaya we have discussed it earlier ka assuring availability of free comprehensive primary health care services for all aspects of CZ da is it user in the Sign towards it. Had the CZ dana yam sang CD. I don't think this is the right time. But anyway, she logical. I know that I'm not looking from the prelims perspective. Prelims ki di schemes in yojna do ay malaki ko. CD overall understanding ga mains ka perspective technical. But let's complete this one, okay? Koina schemes to I don't know. Haying towards. Yeah. Let's write this one, okay? I want to write this one. Assuring availability of free comprehensive primary health care underline to for all aspects of reproductive, maternal, child, adolescence health, and for the most preventable communicable I know in cover communicable, non-communicable, and occupational diseases in the population. We have to appreciate national health policy. Kay no hada Ayushman Bharat kay kamay amdo khambra. Sidagi no in director ko dini ka. So na in order to understand and appreciate the schemes more ka, we have to know the national health policy 2017, right? Adu number 3 subada. Trust in public healthcare system. Trust in public healthcare system ka. Number 4 subada. Align the growth of important noy. Align the growth of private healthcare sector with public health goals. Align the growth of public healthcare sector with public health goals. Number 5. Number 5 specific quantitative goals and objectives. Seasonable. Aduga next sigidi nangi prelims ki. Hadi prelims ki important no. Say for example prelims ka mahang kani khambra. National health according to national health policy ko. What is the life expectancy target we are going we are able to, we are to achieve by 2025. Yeah, I have to go. Say check the question number 7 ba? According to National Health Policy 2017, the life expectancy. Si answer pira kadini ko? Expectancy at birth in the year 2025 is A the 68 years, B the kanana say I'm to no. Nang answer is the A B C no chumdro kanam Patrick. 70 years, C the 72 years, D the 75 years. So, hello. Atay di khang biao bra. Okay. B. Devinana A, Umarjan B, Christina B, Patrick Su B tare. Okay. Yeah. The answer is B. So sumaina haidi akoina National Health Policy 2017 dagi question hangba ma'am yaw ko. Aduga si loy kan question amga lay ko. Si question di phaje. I think this question is nice. Probably they may ask also. Kay no si 2017 da tawkiba mo huji phoboda question hang pay chance there. It is types of current affairs ma'am discuss tawdo. Thaina tawkraba. Huji khabar de yawdrba. But huji impact yam toriba. So all our India health system government health system ja kanana no guide tori ja hamatam ja National Health Policy 2017 na guide tori ne huji si khamra. so na si je dum yam tin relevant oy ko so na hujiki da khoina kari kari oigadabno do ko national health policy 2017 jida hujiki da kai diawi karam health status akoina active tawdamno do ko health status and program impact akoina program semi ma'am jina kai impact tawdamno do ko number 1 da life expectancy at birth ko life expectancy at birth kano from 67.5 huji 2017 da labor 67.5 to 70 years by 2025 2025 to 70 years ki life expectancy target ne koin to is ka ali total fertility rate ka to 2.1 at national level si achieve to doram ne huji 2.3 ga nom le I don't know 2.1 at national level ka aduga and sub level ladi sub national level ladi by 2025 size kya chahi kya dano I iram dire ka so da hoin jeng tai aduga si national health policy 2017 pdf na adum download to ko page 31 khak sang mani ko aduga live live ni ko no imba ka dum phajana yaw ni ko adu adai next ko next ma'am lai gre ko da cd e ko cd hoin no yeng jero ko cd okay ba infant mortality rate ki lere sida adai neonatal mortality rate ki lere adagidi keba under 5 mortality rate ki lere ka so simu ma'am ji no hoen yeng jero ka aduga next question ami yuba next ko had si question ji important o en khale da di ka the 90:90:90 ka global target the 90:90:90 global target by 2020 is associated with A. Cancer, B. Vector-borne diseases, C. HIV, H. aduga D. Cardiovascular disease. Kanano answer sa thazil easy. Okay. Christina C, Gina C, Umarjan H. Kaya no kambra 90:90:90 ja. I think this one is nice. Yeah, it is C, H ko. Hadi sigumba je adum no atop pam du thengnaramani ko. So 90% of the SIB positive or ma'am do kambra. They realize 90% of them realize that they are SIB positive. See 90 is na kaino of those 90% of those who realize they have SIV positive, 90% of them take ART ka antiretroviral drugs ka aduga sije adai next 90% of those taking this ART ART therapy can suppress the viral viral symptoms of SIV. Okay, so na see 90 is to 90 is to 90 target is associated with SIV HOA ko aduga nang akhoi national health policy da ngasagi 31 pages da sumpa matam da ko kai yauni khambra leprosy yaungani ko kala azar yaungani ko filariasis yaungani ko TB yaungani ko blindness yaungani ko adagidi kenoda family planning yawi ko adagidi immunization yawi ko antenatal care yawi ko adagidi kebasija keno sida hadi dana haining is khambra akoina health ki matang da overall hadi India gi national health policy na hamina khambra countries da laiba health ki issues kari kari laige kholi ge ma'am do ko sida nang mental health yangani ko so si ma'am no yangani ko ana nang na health ki oba comprehensive document am yengninga ba you don't need to search for articles you just need to open national health policy 2017 and you just 31 pages point evening ko and you just see what are the aspects of health and mine yeng be ko so adu da ni si yong ne ke yawre khambra tobacco yawre sida adagidi safe water and sanitation yawre occupational health yawre ko adagidi sida s no hom yawre da sidi khutche thi khangdre aduga next ta si point chimtang iramuba si point ji dana highlight to yai ka health finance sida horen document to thabirke or you can download it okay health finance ka C is ne hojik to ka increase health expenditure increase health expenditure by government as percentage of GDP from the existing to 2017 the existing 1.15% to 2.5% by 2025. C is important to 2.5% of GDP by 2025. So C matang sida khoina ke ke yaure ayus yarangani ka hojiki document to ka aduga asa workers yarangani ka adna health ki oiba ba yawe ba khamra adna I think that is the document for you guys to read aduga no hoji appreciate tonga mani ko karam karam mano structure du layamina gyan dai na ka aju but so anyway hayeng class lay hayeng this schemes mem toni ka ngasi aseng bai ngasi to godam ne nangdre ayusman hayeng ayusman bharat toni ka aduga keno da keba ke PMSSY gumba adumba schemes khoi khara tongni ko aduga schemes no bak tawre ko aina amani khak tawrani question semani atay ma'am di noina tawjagadamni aduga I'll ask them in the mock test series right admaya okay ngasi di sibok teng tawji ko aduga tasan khomjin no hono gyan dai na ko hayeng unar ji ko kana fire thame thame da